This is an initial art for Emery Morales. In attendance, we have Mrs. Morales, Emery's mother, Miss Carly, preschool teacher, Mrs. Williams, LEA representative, Mrs. Langley, early intervention representative, and Mrs. Daniela, bilingual educational diagnostician. Thank you very much, Mrs. Morales, for introducing yourself to the art committee. Now I'm going to introduce myself. My name is Mrs. Daniela, and I am the bilingual diagnostician that had the pleasure to evaluate Emery Morales. I appreciate everyone for being here today for her initial art meeting. The goal of Emery's evaluation is to gather comprehensive information about her strengths and areas of need to determine eligibility for early intervention services and to develop an individualized family service plan tailored to her unique needs. Before we begin, I would like to confirm to everyone that we have obtained consent forms from Emery's parents for the assessments that we conducted. Also, please remember that the information we discuss today is confidential and should be treated as such. Let's start by briefly reviewing Emery's background. Emery Morales is a 3-year-old student who attends at Ivy Kids Young Ranch Daycare. She's been at this daycare since 6 months of age. Based on the information collected from parents and teachers, it was determined that there are no sociological, health, language, or behavior factors that may influence Emery's ability to access general education curriculum. Now, let's examine the assessment data that focused on cognitive and functional abilities. I will walk you through the results of two normed reference assessments, the Bailey 4th edition and Battelle 3rd edition. And I'm also going to discuss a play-based functional evaluation. The Bailey 4th edition is a normed reference comprehensive tool for identifying, measuring, and assessing a child's development in 5 different areas. The three of these scales, the cognitive, motor, and language skills, were measured using this assessment. Here I have Emory scores for the Bailey 4th edition. These are the scores for the Bailey 4th edition. We have 3 domains, and 2 of them are divided into 2 subtests. We have the cognitive domain, the language domain, which is divided into the receptive language and the expressive language. Receptive is how much she understands when someone is talking to her, and expressive is how well she can express her wants and needs verbally. Now, for the motor skills, for the motor skills domain, is divided into 2 skills: the fine motor skills, which is the ability of Emery to use her small hands or fingers to manipulate small objects. And then the gross motor skills is her ability to use her large muscles to do pretty much large movements. And so in each category, we have the scores right here. We have that Emery showing cognitive is high average. Then we have language high average. And then motor is the one that was low average. So we can see that she is performing in the low average range for the fine motor skills and the gross motor skills. Okay, oops. Okay. Now, these are the scores for the Battelle 3rd edition. Now, the Battelle 3rd edition is an early childhood instrument based on the concept of developmental milestones. As a child develops, the child typically attains critical skills and behaviors sequentially from simple to more complex. And so the Battelle 3rd edition measures a child's progress along this developmental continuum in global domains and discrete skills sets. So we have the five domains that Emery was evaluated. We have the adaptive, social emotional, communication, motor, and cognitive. Now, as you can see, Mrs. Morales and our committee members, that the Battelle third edition has more domains. So we can only compare the Battelle third edition with the cognitive, motor, and communication, the Bailey fourth edition results. We will not be able to compare adaptive or social emotional abilities with both of these tests. But I have a visual um, that I was going to share to compare them together. So here on this section right here, I have the Bailey fourth edition results. And then this is the left side. And then on the right side, I have the Battelle third edition. And as you can see, because there's no adaptive and social emotional domains for the Bailey, I had graded out the boxes. But you can see that Emery is in the average. I have a typo right here. These should also be grayed out. But Emery is in the average, high average, low average. We have average domain for communication, high average for cognitive, and then low average for motor skills. Now, for the Battelle, she is high average on all five domains. Good job, Emery. So she is high average on adaptive, high average on social emotional, high average on communication, cognitive, and motor. Okay, so let's see what that looks like in this other visual that I have, and this helps anyone in the our committee understand where Emery stands compared to other people, to other students her age. So this is what we call a bell curve. And this is a visual representation of where most of our students her age, most of the students her age fall under. So here is the within the average range. So from this purple area right here to here, most of kiddos her age will fall under this range. This teal area right here to the right is where 3 year olds like Emery will be in the above the average range. And if you continue going to the right, you will be significantly above the average range, and so on. Now, if Emery falls under the left side of the average, right here below the average range, then she will be, like I said, uh, behind compared to the majority of the population that are represented in these assessments. And then you keep going to the left, and you are more you're falling in the significantly below the average range. So I color coded the test results so that you can compare and contrast between the two cognitive tests. And the blue one is the Bailey assessment, and the green one is the Battelle third edition. So as you can see, Emery data points are either within the average range or above the average range, with the exception of the motor skills for the Bailey fourth edition. She's slightly below average with an 84 standard score. Now, the last data that I have is a qualitative data, which was taken from a play-based functional evaluation. It is a interview, or it is a questionnaire that describes Emery during a play-based setting. So some of the questions were: can Emery share with others? Can she take turns? Is Emery able to interact with others when or respond to smiles or facial expression? So there were some of these questions that Mrs. Morales filled out. And based on that, I was able to compare the scores with the Battelle third edition. The Battelle third edition has, let me go back to the subtest for this one. So in the Battelle third edition, we have a social emotional category that focuses on adult interaction and peer interaction. So I was able to compare and contrast the results from the play based functional assessment with the scores from the Battelle. And both fell under the average, high average range. So Emery is doing very well in the social emotional domain. Considering all the data, let's talk about Emery's strengths and areas of need. Overall, she excels in the areas of cognitive. We can see it right here. She's in the average or above average. She excels in the area of language, adaptive, and social emotional. But we've also identified some challenges in motor skills. Based on the assessment data, I recommend the following strategies to support Emery's learning and development. So I would like to propose that Emery receives or gets opportunities to improve her fine motor skills through buttoning, like putting on some clothes by herself, stringing items together, like large beads or macaroni pasta, um, or maybe doing a lacing practice, or through arts and crafts activities that require fine motor skills such as drawing, coloring, using a fork, and cutting with scissors. Play games with puppet fingers using the thumb, index, and middle fingers. Give Emery a pile of objects such as cereal, small marshmallows, or pennies. Give Emery a set of large tweezers and have her move the objects one by one to a different pile. So this will reinforce her fine motor skills. Remember, fine motor skills are using the fingers and hands to do small movements, okay? Now, in regards to her gross motor skills, I am suggesting for Emery to have opportunities to be outdoors or indoor play spaces, such as where she can run, jump, climb jungle gyms, going up and down a slide, kicking or throwing a ball, or even playing catch. Allow Emery to have opportunities to push, pull, jump off, and jump over. Emery should also have toys that allow her to ride them and practice balancing. Although Emery scored from average to high average on the remaining of the other subtests, I would like to also recommend some interventions or strategies to Emery to help her support and enhance these abilities. So, in regards to self care activities, Emery could have age appropriate self care chores posted on a chores activity board that she could follow at home when she gets home from daycare. Emery could benefit from a more consistent night routine. This will this will avoid wetting the bed and can assist with going to bed on her own as well. For communication skills, practice with Emery the different past, present, future tense when talking about different life scenarios. Provide opportunities for peer interaction. I know that she goes to daycare and that's plenty, but the more the merrier, right? And so if you have some play dates, Emery can work on her social and emotional abilities by helping her interact with others and learn from these interactions. And also encourage her cognitive development by providing activities such as counting objects, sorting shapes or colors, and assembling puzzles. Now, let's discuss whether Emory meets the criteria for special education services. After reviewing the assessment data, it is my professional opinion that Emory does not meet the eligibility criteria under any of the 13 disabilities from IDEA. Before we proceed further, I want to ensure that Emery's parents are actively involved in this process. Mrs. Morales, do you have any questions or input at this point? We really value your perspective and partnership in making decisions about Emory's education. Okay. Well, thank you so much, Mrs. Morales. If you ever have a question that comes up later, you can always reach out to me. I know that the LEA representative, Mrs. Williams, have been documenting all the key points that we discussed today. I will provide copies of the assessment results and other relevant documents for your records, Mrs. Morales. Once we've reviewed and finalized the documentation, we will need signatures on the required forms as well. I appreciate everyone's time and collaboration today. If there are no more further questions or comments, we can conclude this art meeting.